Welcome to another tutorial of the skeletal system. Today I'll be talking about the superior appendicular, which includes the arms and the pectoral girdle as well. The pectoral girdle forms the shoulder, which consists of a pair of clavicles in the front and scapula in the back. Its purpose is to attach the upper limbs to the axial skeleton as well as provide attachment points for many muscles such as in the shoulder, the arms, the neck, and the head. Now we'll take a look at our clavicle. All right. So looking at our left clavicle, okay, this end that attaches to the sternum is known as the sternal end of the clavicle. And this side, the flatter side here, is known as the acromial end of the clavicle. Okay, and then we have this bump. The bump is on the inferior portion. So this is the superior portion and this is the inferior portion. So this inferior piece here, this bump over here, is a tubercle, okay, the conoid tubercle. This is very important for orienting our clavicle. So with this bump side down, okay, this tubercle down, we can then orient our clavicle. So the way this works, our more chunky side, our sternal end, will curve inward toward the sternum. So if we can imagine the sternum is right here, curves in toward the sternum, and our acromial end here will curve out this way, so away from the body toward the toward the arm on the lateral side. So this is the medial side, lateral side. Curves out or forward on the lateral and curves back on the medial side. So this is our left clavicle, okay? And we can see this as well in the right clavicle. There is that tubercle down there. Okay, and if I move this like this, we looking down, it curves in toward the sternum on the medial side, and it curves out toward the lateral side, or the acromial end. Now I'm going to talk about the scapula. This is the anterior, so the smooth portion of the scapula is the anterior. So this is the part you really can't see when all of the ribs are in the way. Okay. The posterior aspect of our scapula will have this spine on the back side. Okay. So we have our scapular spine, okay, or spine of scapula. We follow that spine all the way out to the lateral side here, the lateral portion, and this is our acromion process. On the most lateral portion, we have this area here. This is our glenoid cavity. And then on the anterior most, this is our coracoid process. Now what we're looking at here is the right scapula, because it needs to go lateral. So this is the lateral side, okay? And so if we're looking at it from the front view here, the anterior view, our arms will come out here, and so this is the right side. Okay, so the right side. So now looking at our left scapula here, okay, turn it around. The left scapula, we have our anterior view, and then this would be the lateral. Okay, so that goes off to the side, left scapula. Okay, and you can see that this, along with all the ligaments that form this joint, will help to cradle the arm bone here. So what we need to know on the humerus here, so the first thing I want to look at here is the head of the humerus. The head of the humerus. This is going to be on the medial side. And on the lateral side, we have the greater tubercle. Greater tubercle. And then on the anterior side, we have another tubercle, the lesser tubercle. Okay. And then in between, we have this part that's known as the intertubercular groove. So you can see it's a groove in between these two components. Okay, so this intertubercular groove. And then just below in this purple shade here is our surgical neck, the surgical neck. So that is the superior portion. In order to determine left and right, I would look for the anterior side first, okay? And the way we can tell anterior is based on our lesser tubercle, okay? That's the anterior. If we turn it around, we don't see the lesser tubercle, only the greater tubercle on the lateral portion. So this is our posterior view. So we kind of want to turn it to the anterior view here, okay, where we can see the lesser tubercle. This is the medial side because it's the head, lateral, and we know that the head needs to go into our scapula or into our body. This is the medial side, so this must be the right humerus. If we continue downward, we have another structure here on the lateral side. This is known as the deltoid tuberosity. Right? You really need to feel it. It's hard to see, but there's a slight, very slight elevation here, slight long elevation. This is going to be the site for your deltoid muscle attachment. Okay? Deltoid muscle attachment. Okay? Moving down, still on the anterior side, we have the coronoid fossa, coronoid fossa. Okay? And then over here, we have what's called the trochlea. Trochlea. So the trochlea is what our ulna will ride on as we flex our arms. So it'll ride along this surface. Okay? So in a way that I remember trochlea is that your ulna rides on the trochlea train. So if we look at it, let me turn this around this way. When we move our ulna, it'll move all along that trochlea as we flex and extend our arm. This over here to the lateral side of our humerus. Okay, lateral side. To the lateral side, we have what's known as the capitulum. So lateral to our trochlea is called the capitulum. The capitulum, also known as this little head, okay, is a smooth surface that our radius will articulate with. So the ulna articulates with the trochlea and the radius articulates with the capitulum. On the medial side, we have the medial epicondyle. And then on the lateral side, we have what's called the lateral epicondyle. Okay? All right. Now I'm going to turn this around. So here's that trochlea I was talking about earlier. There's the trochlea. And then if I move to the back end, we see this larger fossa or larger depression. This is our olecranon fossa. Olecranon fossa. So again, we can see on the medial side, we have the medial epicondyle. And then on the lateral side, we have the lateral epicondyle. So now if we look at both arms together, we can see that on the anterior sides, okay, we have our lesser. Medial side, we have the head. Lateral side, we have the greater tubercles. Okay. On the medial side, on the right, is our medial epicondyle. Medial epicondyle. On the left, lateral epicondyle. Lateral epicondyle. Coronoid fossa, trochlea, capitulum. Coronoid fossa, trochlea, capitulum. All right, so continuing on, we're going to take a look at our ulna. Okay, so the ulna has a few structures I'd like to know. The first one, okay, see it has like this hook-like shape. It's going to hook right onto that trochlea from our humerus. And this back portion, so we're looking at the posterior side. The posterior side has this large portion known as the olecranon process. Okay, olecranon process, and that's going to articulate with the olecranon fossa. And on the front side, the anterior side of our ulna, this is the coronoid fossa, the coronoid fossa. Okay. So this is our anterior view. So it's like that hook-like shape. Okay, here is the anterior. This right here is our medial portion. So this structure right in here, I'm going to zoom in a little bit. This structure is known as the radial notch. So if this is the lateral side of our ulna, which ulna would this be? Okay. All right, another way we can tell, or we can look at down here on the distal end, on the medial side is this medial styloid process. Okay, medial styloid process. Okay, looks like a little heel if I turn it just so. Okay. Okay. All right, and that's going to form the little bump that we sometimes see on our wrist. Okay, that little bump on our wrist, on the back side of our wrist here. Okay. All right. Now we're going to take a look at our radius. Our radius. We have a radius here. So the radius component, we have the head of the radius right here, the head of the radius. We have the radial tuberosity right in here, this bump, and that's going to form a joint within our radius and ulna. And you can see if I zoom in, the radius articulates with that radial notch right here. Now if we move further or more distally along the radius, we have this structure here, which is known as the styloid process. It is the lateral styloid process, the lateral styloid process. So this forms our lateral side, which is down by our thumb, okay? So if our thumb points outward over here, this must be our right side. So this would be our right ulna. Lateral. Okay. Okay. Now one of the ways that we can tell or orient our radius on the posterior aspect of our radius, it's a lot bumpier on this distal side. You can see all these little ridges, so it's a lot bumpier, whereas on the anterior side, it's much, much smoother here. Much smoother surface. Okay? All right. Last structure on the radius here is called the ulnar notch. The ulnar notch right in here. And this is a smooth articulation site. You can see it a little better there. Articulation site for the ulna. Okay, now we'll look at the carpal bones. I'm looking at the anterior aspect of our right hand. This is the thumb side. Okay, so we'll zoom in. The first bone on the thumb side, closest to the thumb, is the trapezium, followed by the trapezoid, capitate, hamate, pisiform. Okay, and then back up again. Scaphoid, lunate, and triquetrum.